it's just except for that moment in time yesterday afternoon, it's been a pain level 10, 24/7 for a month. It's driving me crazy.
Yeah, so 4 weeks ago, you had a total knee replacement on one or both knees?
Just the right.
Just the right knee. And terrible pain 24/7 for the most part. Yeah, so it sounds like you have some days or some moments where it's pain-free?
Just last night was yesterday afternoon, and last night was the only time that it's been pain-free this whole time.
Got it, okay.
And the first 4 days after surgery, because the anesthesia was still kicked in, it was okay.
Okay. Now, where are you right now sitting? 0 to 10, 10 is like maximum pain possible. Where are you right now?
If I'm sitting doing nothing, there's no pain.
Okay. So what we're gonna do is I'm gonna have like before and afters. You know, we're gonna see where you're at now when you do a certain movement. Then I'm gonna do whatever I do, and we're gonna have you get up and test it, and we're gonna see how much better. And then from
Okay.
there, we'll kind of dictate where we want to go next.
Okay.
So just to kind of just know right now in this moment, what movement could you do? And actually, if you want, stand up and actually do it so we know exactly where it's at. You need to put yourself in a lot of pain just so you know that you're still in pain and what that looks like.
No, I mean, it was just in pain before I came, sat down, and put the phone on. So, I mean, all I got to do is stand up. And I mean, as soon as I put weight on it, there it is.
Okay.
I mean,
and that pain that you felt, where on that scale?
I mean, like I said, it's right there at 10.
10. Okay. All right. So you already understand the zones. Of course, we're both in this thing together. So what we're going to do first is we're going to find out what zone's going on. We're going to clear it, and then we're going to see how much better it is, and then we'll go from there.
Okay.
Cool. So your part, obviously, you don't need to do anything. All I ask is maybe just kind of close your eyes, just get into like a nice quiet state where almost like a meditative state. And then let me kind of handle the rest. And then I'll call you to open your eyes.
Okay.
When I'm ready to.
All right.
Okay. When you're ready.
Okay.
And stand up for a moment and see where we're at so far. And by the way, be honest. No trying to make me feel better. We want to be 100% honesty here.
I'd say it's 25% better. Because I mean, it was immediate. As soon as I stood up, every time I was like, But I mean, it's at least 25% better.
Okay, so on that scale, where do you want to put it above?
Uh, we'll say 7, 6
7.
or 7.
Cool. So we got some movement already. Great. Let's see where next here. Let's do a little visualization.
Okay.
And again, kind of get into that same kind of state. Just closing your eyes, and then. So I know you've done these before. I'm sure you've seen Dr. Pete do these, but just recap is I'm going to describe something. It might be just like how things were in the past. It might be a little bit. Some pieces yes, some pieces no, or it might be totally the opposite. Doesn't matter. We're not here to reminisce or remember. We're just creating a movie in our mind. Fair enough?
Yeah. Gotcha.
All right. Can you remember when you were around like age 8? Do you remember what you looked like about?
Yep.
All right. So, and you were in school around that age, correct?
Of course.
Okay. So I just want you to see yourself. You're outside, and you're playing with like your classmates, like outside. Some recess, or it might even be after school, but you're playing outside with your classmates, and you guys are being real active. You're running around, and this some guys that were almost like bullies kind of thing. You kind of every time they came in the room, you're like, okay, you kind of knew it, like, oh, maybe trouble kind of thing. And they came up to you, and when they kind of looked at you, they're like, hey, she's like, we want to ask, like, do you want to play on our team? It's like, you're really fast, and we could really use your help. Like, would you be willing to help us out? A little shocked. We're like, yeah, I can help you guys. And it was just like this, you had this sense of like, I matter, I'm important. I'm really giving value to these guys, and they're recognizing it and they're appreciating me. Let me know when you can see that in your mind.
Yeah, I can see it.
Cool. All right, so come on up and see how much better that knee's doing so far.
I'd say it's at least 50% now.
Very good. What does that number look like on that scale?
It's like a 5 now.
5. Okay, good. All right, let's continue on.
Okay.
So sometimes, now we know, like, you just went through a big surgery, but even when people go through surgery, sometimes there's pain, sometimes there's not, sometimes there's healing that needs to continue going on, but we can still feel good even when there's healing going on, right?
Right.
So with that said, is we want to look at like what things might be getting in the way of it healing even faster. Because they give us set times of, okay, it might take you a month or 2 months or whatever it is to heal. But that's with normal people that don't know what we know and don't know how to do what we do. And so that time frame is reasonable for them, but it's gonna be a little different for us. And so what we're gonna do now is see if there's anything on a more emotional level that might be getting in the way of healing even faster than you already are. Because your cells are constantly replacing like trillions per second. So why isn't the body replacing healthy cells when it's reproducing? That's based upon the concepts that we hold and the emotions that we have. So I'm going to check now, seeing if there's any emotions that are slowing this down.
Okay.
And if I'm looking down, I'm just kind of looking at a little chart of different emotions. So
No worries. You do what you do.
Okay, so here's how this is going to work. Is in a moment, you're going to be actually doing the clearing. So here's how you're going to do it. First is we're going to be clearing the emotion of fear. Now, sometimes we need to know more information, but all we need to know for this one is this just a trapped emotion of fear. It's some fear. It's like a think of it like a virus on a computer. Kind of gets installed on your computer without your acknowledgement. That can happen in life too. And this fear could come from our parents, our friends, our mother, father, teacher, preacher, whoever. These just life. So here's what I want you to do: is just in your mind, just saying silently in your head, I am now releasing this emotion of fear. And you can just say that simply one time. And then I'm gonna have you see the color purple, like maybe a purple ball or a purple flame, whatever you want, whatever makes sense to you. The color purple floating above your head. And in a moment, not yet, but in a moment, you're gonna breathe in. And when you breathe it in, imagine you're sucking that purple color down through the top of your head, down through your spinal cord, all the way down to your tailbone, and then seeing it going all the way down to that knee. And then when you exhale, just imagine that's getting that purple color is getting sucked back up through your spine, up to the top, out through your top of your head. Is that clear?
Okay.
So when you're ready, just see that color purple in your mind and breathe it in.
Hold on a sec. Everything's kind of black right now.
Yeah, no problem. Take your time. We're in no rush.
I gotta be honest, it's kind of hard to imagine color purple.
That's okay. That's okay.
Yeah.
That's not terribly uncommon. So with
I'm
this,
just sitting there, I'm just trying to get it there, and I'm like, everything's changing color, but it's not going to purple. So
yeah, no worries, no worries. No need to try to like really force it too hard. So given where you're at right now is just can you see just even like, if you could just imagine, even if you don't see it clearly in your mind's eye,
okay.
just set that, like say, I know purple energy is coming in, and just see it coming out. And don't focus too hard on the color.
Okay. Just one time?
Yeah, just one time.
Okay.
Good. And standing up, and we're at about a 5 before. Let's see how we are now.
I'd have to say it's probably a 23 and a 4.
3.
It's tolerable.
Now I'll say, like, we started at 10 and we're moving down to a 3, 4. So this is great. We're going to continue. We're going to get it even lower. And I mentioned this before, but you're going to be feeling really good. Just know that you're healing, but I wouldn't, jump out and start playing pickup football and all these things.
No, that ain't gonna happen, trust me.
Be more functional at work, though. All right, so we're going to move on to the next one that's looking to be released, and that's going to be the feeling of grief.
Grief?
Grief. Let me see if there's anything else we need to know. Okay, so this is going to be grief that you picked up at age 2. Now, a kid, right? A kid. So this can be, and this actually came from, it doesn't matter who it came from, but it didn't come from you. Okay, so it's, again, it's kind of like, they say a kid from 0 to 7, their mind is wide open. Their conscious mind isn't fully formed. So it's
Yep.
like anyone can download programs into the little kid, you know? And so that's why we pick up a lot of the stuff from our parents, because we're around them more. So we picked up a feeling of grief at age 2. That's all we need to know. It's all that's relevant right now. And let me see how many we want to do. Okay, this time we're going to do the same process. Seeing the color purple, or best of your ability, purple. And you're going to breathe this in twice.
Okay.
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 Excellent. And at your face, let's see how it is.
I'd say the pain level is 1. The stiffness level is still pretty stiff, but the pain level's probably a 1 now.
So we moved, just for my own clarity, we moved from like a 10, it was extremely painful, and we've gotten all the way almost totally pain-free. Am I
Right.
right? So
Correct.
we're doing pretty good.
I think so.
So all right, I'm gonna do we're gonna do one more. Actually, see, let me see if there's any emotions left. Okay, so this one is gonna be confusion. And again, sometimes we need to know more details, but right now we don't. So this was confusion that you picked up from mom.
From mom.
Yeah, at whatever point.
Okay.
Sometimes it's in utero, sometimes it's as a kid, sometimes it's a little older. Doesn't matter right now.
Okay.
Okay, same process, setting the intention, releasing confusion from mother, and then breathing in and out twice.
So I'm
Yeah, first set that, just like kind of telling your body, your nervous system, hey, here's what we're doing. We're releasing this feeling that we picked up from mom.
okay, releasing confusion. Okay.
And then doing the same.
Same color purple and everything.
Yes, sir.
Okay. 1 breath, 2 breath.
2 breaths.
Okay.
In, out, in, out.
Okay.
And come on up.
I'd say it's virtually gone. The stiffness there, but the pain just, you know, I'd say the pain is just maybe a point one. There's a little hanging in there, but it's virtually gone.
Cool. So I'm going to do one more thing. You know, even if we left it right now, you're doing great. Like we got you all the way from 10 down to a 1 or less than a 1 in 20 minutes. So the next, I'm going to do one more thing. It's going to be something kind of interactive, and it's really short. And partially why I'm sharing this with you is this is something that you can do on your own whenever. It's a very powerful process. So I'm going to teach it to you after though. First, I just want you to be fully just listening, being in the process. Don't be, so here's what I want you to be mindful of. Don't be in doctor mode and patient mode. Just be in patient mode right now.
Okay.
Yeah. All right. So for this part, we're gonna actually engage some of the body a little bit too. Okay. So I'm gonna ask you what color something is. Just first reaction. If just the color red pops in, you don't even know why red popped in. Good. Just say that. So first reactions are always the correct reaction. And overall, I'd say is just kind of be playful and just give yourself up to the process. You know, it's kind of like as a little kid when we did make-believe stuff, imagination games, we didn't ask ourselves, am I doing this right? No, I'm a cop. That's the robber. Let me grab this stick because that's my gun, right? And just fully immersed in it. Like we were, you know, we're just fully into it. That's how I want you to be in this process. Is that clear?
Sure.
Cool. All right, so when you're ready, I'll be close your eyes. And using, actually just take a deep breath in and out just to really get kind of centered in the body. Good. Now using your mind's eye, look at the knee and notice any of that discomfort, any of the pain, any of the tightness that's left. First reaction, what color is associated with that?
Red.
Red, great. So what I want you to do is physically, keeping your eyes closed, but with your physical hand, I want you to reach into that right knee and act like you're grabbing all of that red energy, and I want you to hold it into your hand in front of you. So physically reach down and grab it.
All right.
Good. Now double check. Did you get it all? Because sometimes that shit likes to hide.
Well, if I go back, I'm going to lose what I'm holding.
Yeah, well, keep on holding to that. You can grab me with your other hand.
Okay.
And just keep on reaching and grabbing all of that energy until you know that you have it all.
Okay.
Perfect. Now, again, using your mind's eye, did that color in your hand, that's in your hand now, did it stay the same color or change at all?
It's kind of clear.
Clear, very good. So I want you to notice that more clear energy in your hand, it's spinning in a specific direction. What direction is it spinning?
That I can't tell.
Okay, is it static? Is it motionless?
It just looks like gel.
Gel, okay. So here's what we want to do is we're going to get this gel moving in a direction. Now, I don't know what the direction is. We're going to have you just intuitively, just know that you can't do this wrong. I want you to start to physically spin this energy. However you want to spin this energy, you can grab with both hands and turn it like a car wheel or spin it with your finger, whatever makes sense. I want you to start to spin this in the direction that you just, for whatever reason, you just know to spin in that direction. And I want you to see this energy spinning faster and faster. Every time your heart beats, I want you to see this energy double in speed. Every time your lungs breathe, doubling it again. And just see it doubling over and over. And it's starting to spin so quickly. It's like a plane or a helicopter propeller. It's starting to spin so quickly that you can't even see it anymore. It's almost disappeared. And it's spinning in this brand new direction as it's picking up speed, and it's doubling and it's doubling until it takes on a life of its own, until it's self-sustaining, spinning in this new direction, constantly and continuously continuing, until it really takes on a life of its own, until you know it can never go back to the way it was before. Once you know you have it at that speed, I want you to take this energy, slam it right back into the knee.
Okay.
Feel that energy kind of flowing through the body, kind of up to the top of the head. And as it's coming down through the body, down to the soles of the feet.
I actually do.
Very good. Feel the energy now moving back into the knee. And it's almost like, you know, you got an iPhone update or a computer update where the software is different, the functioning is different, how things work and are communicating are different. They're functioning different and they're feeling different, and it's healing faster. And once you notice that, whatever you notice, those things start to calm down. No rush. But when you feel done and complete, you can open your eyes. And then when you're ready, stand up at your own pace as well.
Other than stiffness, I can't really tell anything.
Beautiful. All right, and so that was kind of that's as far as we need to take it today. Now I expect this to continue to feel like good. You know, the knee is going to continue to heal, and it's going to do whatever it needs to do to heal. But we cleared out any like the stuff in the way. So now the body is just free to heal it as quickly as it's naturally able to.
Okay.
Any questions for me?
As far as what we did or anything, this is all high level stuff. Nothing I do at the office, that's for sure. Do you do this stuff at the office?
Not this many layers. I might toss in like one thing here, one thing there.
Okay.
And you know, we could have left you like maybe halfway through, and it would have still got like all the way better. But it's just I partially have fun with it, and I like to share different things and kind of expand minds on what we can do, and we'll actually create shifts in people.
Yeah.
But rarely will I do it. Every once in a while, I'll kind of, you know, I have an online course for my patients, and it's just some basics, you know, talking about like the 4 physical laws of health and some other things. But I toss in that last thing we did called the energy spin, because it's very quick. It's like 5 minutes or less. It's like 2 minutes, and you can do it on yourself, and it works. So I ripped up that I'll sometimes share with people, but I have it on my online course so they can go through it and try it and use it.
It's cool.
Any other questions?
The only questions I have is for you is how's business?
Oh, it's been good. You know,
Yes.
healing the people's the easy part. You know, getting people in and face masks and all that.
Kind of a pain. My business went down maybe 20% in the middle of all that stuff. But right now, I hate coming into the office saying, God, I hope it's not busy because my knee's killing me. That's the way I've been the past 2 weeks, even though I've been here. And it's been fairly busy. I love coming in and saying, I love seeing patients. I want it to be busy. I want it to be busy. And that's what that's usually my mindset. But here recently, it's just been, God, I hope nobody else comes in because it's killing me.
Yeah, I understand that.
No, but business is still good. You know, like you said, I've been in business so long that I've just got people just keep coming in. So
very good.
And I want that for you. I want that for you because, you know, results speak for themselves, and people should be out there talking about you.
Yeah. We're we're chugging along, and the universe will kind of make me ready when I'm ready, and you know, whatever else. But in the meantime, I'm fixing people up, getting your knee feeling good and, you know, strong and stable.
Yeah.
So cool. So my expectation is like, I want you to check in with me, and I want you to let me know, like, did this stay at a 0 and you've only had stiffness, or whatever, right? So just kind of keep me updated, and
sure.
You know, I expect this to be really. I expect the surgeon, whoever you want to be like scratching his head. He's confused on why you're doing so well.
That'd be nice.
Yeah,
I'm
so
all
let me
for
know
that.
how that conversation goes whenever you see him or her next.
I see him in not till July 2nd. So I just saw him yesterday.
Oh, okay.
Because I was having so many problems, they wanted to X-ray it, and they X-rayed it and said everything looks fine. Yeah, he said you did. All his response was, "You just had major surgery. It's gonna hurt. You know, it's gonna get better though. You're doing fine. There's nothing wrong."
There you go.
I said, "Okay."
Well, since you're healing great, now we just took care of that little sensation part of it. And now you're gonna be able to enjoy work.
Hope so. Hope so. Anything I can do for you?
No, nothing at all. Nothing at all.
Okay.
Just kind of keep me updated. I just want to know
Oh,
how it's going.
I definitely will do that. I'll send you a message tomorrow and let you know how it went through the rest of the day and over the night.
All right, sounds good.
All right, Magic Mike, I appreciate it, buddy.
Yep, thank you. Take care.
Anything I can do for you, let me know.
All right, will do.
All right, brother. Take care.